Hey everyone, welcome back to Health Made Simple. As you know from the previous videos, my dad has vascular dementia and it has progressively gotten worse. So this video, I'm going to share with you our experience in going to these two assisted living facilities. My parents are located in Northern California, just about an hour drive north of the Bay Area. Visiting these two facilities in Northern California, I wanted to give my mom a glimpse of what an assisted living facility looks like, to kind of give her a perspective that assisted living is not a scary place. And I say this, but I know that given what my mom said, she was scared that we're taking her, and she realized that this could be her going into an assisted living place. And for her, she didn't want to end up there. And I get it. Nobody wants to end up in an assisted living facility. Who wants to do that? You lose pretty much all your independence, especially if you have dementia. The assisted living facilities is not a nursing home. Nursing homes are regulated federally. The two experiences I had with these assisted living places, one was a larger facility. These are ones you probably are more used to seeing out in the community settings. And they have multi-units, floors, and they're broken down by rooms that are private and rooms that are shared by the same gender. They tend to have a memory care unit. The mother-in-law's facility had the memory care on the top floor, and it was pretty much locked down, meaning that it was only accessible through locked doors, and there were security measures in place so the residents can't just wander. Two places that we visited were two different feel. One was essentially a residential home that they converted each room for a resident. And this was a 6-bedroom home that was converted. And it was super clean. The owners were really nice. It looked like a home that I wouldn't mind living myself or putting my parents. I found it interesting because I didn't know that these homes, these regular houses could be converted and be licensed to be a memory care, but apparently it can be. I guess it depends on the county or the city. We did visit another assisted living, more of the traditional standard type of building. Looks like a college dormitory. The way these assisted living places are set up, some have memory care, some don't. We looked at one that did have memory care. When they have memory care facilities, they may give it a different name and may not call it memory care. I'm just used to calling it memory care because when my mother-in-law was in the assisted living facility in Southern California, it was called memory care. But other facilities may call it something different. This place had memory care, and we came right before lunchtime, so they were gathering the residents for lunch. These facilities, you have a main dining hall, usually separate. So memory care unit in the case of this place was in a separate wing of the building. And they have their own dining hall, their own lounge area where people can watch TV. And usually they will have living quarters that are either shared or private. And of course, private is going to be a little bit more expensive. My dad, who is very hard to get along, would do better on a private room, but my mom thought that he would do better in a shared room. That way he could interact with his roommate. So I thought that was quite interesting, an insight that about my dad and my mom I didn't pick up. In terms of pricing, with any type of assisted living, community care, it's going to be expensive. So we're looking at, for the larger place, it was around $5,000 per month for just the room and board. Now for the residential location, the one with the 6-bedroom, that was a little higher at around $6,500 per month. So this is just for the room and board and the 3 meals. What brings up the pricing even more is essentially the level of care that your resident needs. The bigger nursing facilities, and with the smaller one as well, they're going to have levels of care. So it could be category of 1, which is a minimal of care. Then you can have a category of 10, which is the highest level of care. And that could include, for example, maybe your loved one needs to be fed. Maybe there needs to be 2 people giving them baths. Things like that could add on to the cost. So instead of looking at, let's say, $5,000 a month, it could jump to $8,000 to $10,000, even more. So the facilities that we looked at are not 5-star hotels. They're essentially the average, what you would expect to take a family member and bring them there without feeling badly about it. There are other assisted living facilities that are cheaper, but I would encourage you to visit those locations. We're fortunate enough to have some of the funds necessary to put my dad in a facility, but I know most Americans don't have thousands of dollars laying around to help with this kind of care. So I understand that. What I learned about these assisted living facilities is that it can vary so much from state to state and how they're regulated. Assisted living places or some places similar to that are not regulated by the federal government. There is no oversight by the federal government compared to nursing homes. So those are highly regulated. Assisted living places are not. Not all states equally care for their dementia patients. First, let's clear something up. Nursing homes have federal rules because they take Medicare and Medicaid. But assisted living and memory care, no federal rule book, none. They're zero. Every state gets to create its own regulations from scratch. Staffing, training, night coverage, inspections, all of it. So state A might require strong dementia training and awake night staff, while state B might not require either. Which brings us straight into California versus Texas. What the rules actually say between these 2 states in terms of caring for their dementia patients. Let's start with night staffing, because night is when so many dementia-related incidents happen, like wandering, falls, confusion, and agitation, like my dad. California requires awake staff at night in assisted living and memory care. Super important. If I'm going to put my dad into a memory care facility, I want a staff that is awake 24 hours a day. I mean, if you think about it, that's why we're paying this much money, is so that we could have a body looking at and taking care of your loved ones. So in California, it requires awake staff at night in assisted living and memory care. This is a big safety layer, especially for residents who wander or need bathroom help. Now, let's compare that to Texas. Well, awake night staff is not always required. Boo! It depends on the license type. A lower level facility might not have anyone fully awake overnight. So imagine this. It's 3 a.m., your loved one wakes up and confused, tries to leave their room or needs help. In California, there must be someone awake. In Texas, well, not necessarily. And families often have no clue this difference exists. So be sure to ask. And what about training? What's the difference? Training of your staff members who are going to be taking care of someone with dementia. This one really hits close, especially when you've watched someone you love decline cognitively. Well, let's look at California. California requires 16 plus hours of dementia-specific training before staff can work independently, plus yearly continuing education. Now, this is similar to having your registered nurse license. For example, for me, every 2 years, I have to renew my registered nursing license through the California State Board. In order to renew that 2 years, you must be attending some kind of continuing education, because you want to make sure your family members are given the most up-to-date care. Well, Texas requires only 4 hours of dementia-specific training for memory care staff. What do you want for your parent? If you're a caregiver and you know the difference between a staff member who understands dementia behaviors and one who doesn't, 4 hours versus 16 is not a small difference. It affects safety, dignity, and how well someone can interpret behaviors like wandering or agitation. What about transparency and inspections? And also reporting. Let's look at California. Public website with facility inspection reports, complaints, fines, and citations. Now that's transparency. In Texas, much harder to obtain detailed inspection reports. Families often have to call regional offices directly. Sounds like they're behind their times. So even trying to compare facilities is easier in California than in Texas. And why does this all matter for your families? Because caregivers like my mom are already exhausted. They're dealing with confusion, mood changes, medication schedules, wandering, and the emotional weight of watching someone steadily decline. Last thing they need is a system where the quality of care changes from one state to another. If you believed memory care was always staffed the same, and if you thought training hours were standard, if you assumed memory care means the same thing everywhere, well, you're not alone. Most families assume that, but the truth is the state you live in can determine how safe, skilled, and supported your loved one is. So what can you do as a caregiver? If you're comparing facilities in any state, here's what you should always ask. And also make sure to document. Are your night staff awake? And if they hesitate, that's your answer. How many hours dementia-specific training do all staff receive? And not just orientation, dementia-specific training. Where can I see your latest inspection reports? If they aren't public, ask why. And that tells me if it's not public, is there something that this facility is trying to hide? And what is your staff to resident ratio during day and at night? And how do you handle wandering, agitation, and behavioral symptoms? I think this is something that you need to probe and ask. If your family member becomes agitated, physically disruptive, or is there a protocol in place for those type of behaviors? You're putting your loved one in a place that you can't really see 24 hours. You can't observe. So the only way you can take some of that control is to understand how that particular facility runs. Because you deserve transparency. You're paying top dollars, and it's your right to understand what kind of service, what kind of care, what kind of level of care that your family member is receiving at these facilities. And your loved one deserves safety and dignity and care from people who actually understand what dementia is like and how to care for people with dementia. Every family deserves to know this information. So if this video helped you, please share it with someone who's going through it. And if you want me to make similar breakdowns for other states or turn this into a visual guide you can print, let me know in the comments section. Also, I'll put these informations and questions down below. Now, before I say goodbye to this video, one of the most challenging part about this phase in our life where we are taking care of our parents and possibly having to put them in a nursing home or an assisted living facility, especially if they have dementia. It's so difficult for not just yourself, but the family member who is entering this type of facility, as well as their partners like my mom. She was very concerned that by me taking her to these places, she thought that, oh, this is kind of the precursor of what's going to happen to me. I think she's an easier person for us to take care of. My dad's personality is one of those type of personalities that you just can't get along, and it's just difficult. Whereas my mom is someone that you can actually take care of, and she'll be appreciative, and it's not a true stressful burden as if we're going to be taking care of my dad. So I wanted to put this out there. If you're going to be visiting nursing homes or assisted living facilities and you're taking let's say your mom or dad who's not going to be in the nursing facility or the memory care, just know that what they're thinking may be that. So you might need to reassure them, explain to them that this type of care are for people with dementia that needs structure, 24-hour observation. My dad's case, he is forgetting or refusing to take his medications, particularly insulin, and that is going to be a medical emergency. So It's better that he's in a facility where there was something that happens, we could definitely take action quicker than if they're alone in their home. Wouldn't it be great if we had a national registry of these type of memory care facilities that do take care of dementia patients? Something to think about, something that I would like to see. What are your thoughts in terms of your experience in taking care of someone who has dementia?